And what are the main barriers to exercise adherence in physical therapy?
Yeah, this is kind of the classic question, right? How do we get people to actually do their exercises, especially people who, and like, there are the two types of PT patients. There's the older patients who, some of them may just never have had experience doing exercises, and it's a massive behavioral and lifestyle change for them. Of course, you got the other end of the spectrum where it's people who are getting injured because they're too active. So then that's a completely different approach. The perceived barriers, there have been a lot of studies on this. Forgetting to do exercises, that's a big one, and not having time. So what I always recommend, on our mobile apps, we queue patients automatically with push notifications and give them the ability to schedule reminders. That's a big way to kind of automatically intervene through technology. But as far as from a PT's perspective, when you give them the home exercise program, you can have a discussion with them about how they're going to do it. So you can say, oh, this typically will take, 15 minutes to get through this home program. I want you to do it once per day. When would be a good time, you think, with your schedule where you'd be able to get through that? And do you have 15 minutes, or should I give you a more abbreviated one that's only 5 minutes per day? Having conversations like that starts to give people the ability to actually map out their schedule in a way that they can kind of more realistically approach doing their home exercise programs. And because, more than 3 exercises in general for people who aren't used to a lifestyle change is really, really tough. That's what a lot of people are saying these days. It's just 3 exercises. Start with that. It's better than nothing. So, and that's another thing, is like trying to identify the patients through those conversations. If it's the one on the other spectrum where they're used to exercising, they want to get better as quickly as possible, you can give them more exercises because that behavioral change won't be as difficult. Whereas if it's somebody that is getting injured because they're completely inactive, that's a different approach. So yeah, that's the first one, is not having enough time or forgetting to do it. Does that one kind of make sense?